profile is really mild. Like any side effect is like in the 10 to 15% range of drop in your counts a little bit, but not to the point of needing transfusions most likely. Maybe a little nausea, maybe a little effect on your liver function test. So remember before I told you how the graft versus host disease and the graft versus leukemia are like one and the same? Mm-hmm. Some people think that this Vidasa can actually separate them and augment the graft versus leukemia without causing graft versus host disease. That being said, we don't know everything yet. And so if somebody has active graft versus host disease, we actually delay doing or even don't do the Vidasa. Yeah. So to do this Vidasa thing, you have to be ready to be like flexible, because sometimes like we'll sit down with you and we'll get consent for it and we'll tell you our plan is to do 12 cycles, and each cycle is 5 days in a row through the IV or subcutaneously, and we tell you that's a good idea, let's do this for 12 cycles. But many of our patients only get 4 cycles or 7 cycles, and they hit some wall of graft versus host disease or count suppression or some reason. So we want to do it when we can, but we don't want to push it to the point of causing more harm. And the reason I thought of telling you this now is because of the line. So historically, we might take out the line at day 100, but if you're going to do Vidasa, you can do it without a line, and if you really hate your line, we can do it subcutaneously. But in my experience, like Lovenox shots, in my experience, people don't like it that way, and you'd probably rather have your line. But let's say that's the only thing we're using your line for. We could switch that line over from an external line with a dressing to a portacath that's under the skin, and then when you're on your 5 days in a row, we could stick a needle in it, and then when you're done, we can take it out, and then you just have like a little bump here without a dressing. So that's a possibility when the time comes to talk about a portacath. So, let's see what I want to tell you. So, doing this transplant is very complicated. I think even in the best world, you're going to be tired. And so you could be depressed over that, or you could just kind of wrap it into your paradigm. Like, this is the way life is now. And as long as I got to enjoy this and that and the other thing, if I needed to take a nap or I don't have my old strength back, it'll come back someday. I just have to be patient. So it's like in the best case scenario, I think give me 2 years. Like hopefully by 2 years, we'll have you off all immunosuppressive agents and not have leukemia and be on minimal meds and have your energy coming back and live happily ever after. But for some people that could take 5 years, or once in a while longer than that. That doesn't mean they're in the hospital, but sometimes people have issues with graft versus host disease where we get the tacro down to a low dose and then we're actually afraid to get rid of it because maybe it only takes you a 0.5 milligram to keep everything under control, but getting rid of that 0.5 milligram might make you turn into like the woodman or your eyes have a problem. And so we have to kind of go with the flow and decide what's best for you there. You might get admitted to the hospital a couple times for graft versus host disease problems or infections or other problems. If you're on prednisone, that opens a Pandora's box of potential side effects, like it could cause temporary diabetes, needing insulin, or blood pressure problems. It can cause bone demineralization, and we're very aggressive about that, putting you on meds to protect your bones. It can cause ulcers, so we keep up the protonics. Being on all these meds can whack out your emotional status and coping mechanisms. A lot of people end up on an antidepressant, just a mood stabilizer. So your medication list is much longer than it is now, and it probably involves like 4 antimicrobial drugs, antivirus, bacterial, and parasite, fluids and magnesium. If you're on tacro, if you're on prednisone, maybe blood pressure med or insulin, and other supportive meds like that, maybe nausea meds or pain meds. So over the course of time, we hope to shrink this thing down, but we have to be very patient because everybody's different and you can't hurry it up. It is what it is. So if you have in your head it is what it is, you're gonna cope with it better. There could be some long-term effects, like effect on your thyroid function. There could be secondary cancers from being treated for one cancer. It could cause another kind of cancer, whether that's a skin cancer, a thyroid cancer, or a different kind of leukemia. We have to be on the lookout for things like that. And it can cause your immune system to be suppressed for a long time, so you have to take precautions like your mask and hand washing and things like that to try to not get infections, because infections can actually stimulate graft versus host disease. The other thing that can stimulate graft versus host disease is sun exposure. So we're very big on sunscreen, because if you got sun, not even a sunburn, but does a little sun damage to your skin, the lymphocytes get all activated, and then these activated lymphocytes travel through your body and can stimulate other kinds of graft versus host disease.
You're okay this weekend, but after this weekend, we're going to really kind of nudge you about being careful in the sun.
I guess my biggest thing to tell you is that this is like a job. This is like a full-time job, and it's not a quick fix. And you can find ways to enjoy your life as you're getting through it, but with the restrictions of doing it safely. And you know we're always going to be honest with you, and if we have bad news to give you, we're going to give it to you straight up so that you can make good decisions about it.
The only reason we would recommend someone, and you know more about this than most patients do, with your brother and your previous experience, is that we don't like the alternative. This isn't a guarantee of a cure, but it's the best shot at one. And the alternative, we don't like at all.
So all your you have lots of kids, right? So do you have a plan, like who lives in your house?
My son and daughter-in-law.